Hi class. So for my respiratory disease, I choose pneumonia. Hold on, I have my notes here. Yeah, my phone. Anyway, I choose pneumonia. First of all, like, let me know if filters are not allowed. I just like to do something different. And not so boring when it comes to talking about these type of things. Anyway, this was pneumonia. It's a lung infection that causes the air sacs to fill with pus or fluid. This disease range from mild to life-threatening, and anyone. It doesn't matter age. It could be like a newborn, or like an 85-year-old man, 40s, 30s. Anyone can get it. Okay. Um Usually, the ones that are at higher risk of developing pneumonia is very young children under the age of 2, and older, like I said, older adults like over 65. And first I want to explain why I choose this diseases, because my dad has been in the hospital 3 times for this disease. Respiratory infection, pneumonia. Well, he went for something else and ended up cutting like mild pneumonia, and then it started getting worse because he's like, I don't know, I think 57 or something like that. So he had to spend a few days in the hospital, and I usually try to make my videos about things that I can relate. I feel like it's better to talk about something that I experienced or somebody close to me experienced than to talk about something that I don't know, okay? Or like that I had to do a lot of research and I don't fully understand it, okay? Um, um, some of the people that usually get it like are people with chronic disease like COPD, asthma, heart failure, or diabetes, or sometimes like if you get a mild cold and it doesn't get treated properly, or you just ignore it, you can get pneumonia from that. Okay. And then there's also like if your immune system is compromised, like you have HIV or AIDS, or you're going through chemotherapy or long-term steroids, or you just have like a weak immune system, you you're gonna have to be careful because you're most likely to get that. Okay. Also, like if you're around like people that smoke, or excessive alcohol use, that can be a risk factor to contracting this infection. Okay. Diagnosis and symptoms can vary depending on age. It's not always like, oh, this person has pneumonia because like the symptoms are the same. No. Okay. Symptoms vary depending on age, overall health, and if the cause of the infection is bacterial or viral. Okay. So that's one. The mostly common symptom is coughing like non-stopping, and it can produce like yellow, green, or bloody mucus, high fever, sweating, chills. Sorry. One that not a lot of people talk about is shortness of breath. If you like feel like you can breathe, or like you walk and you're like having problems breathing, that can be a cause. Chest pains when breathing deeply or coughing right after taking a deep breath, that can be a cause of anemia. On other adults, signs, they can present some signs of confusion, Sorry, my baby's crying. Sorry about that. Delirium. They might have falls or sudden loss of appetite rather than the classic symptoms like fever or cough. And the way to diagnose it could be through an chest rate, going to the ER, let them know that you have symptoms of pneumonia. Like, sorry, my thing is gonna die. Like, my dad, he went into the ER for something totally unrelated. Well, not totally unrelated about it, but, he had a really bad cough, and then he just thought he had, like, the flu or something, and so since he's old and his immune system has been compromised, so he went to the ER just to get treated for the flu, and it turns out that he had pneumonia, and not the mild kind, it was the severe one. He had to be intubated and sedated because it was that bad. And he also had other problems, but twice he went for that because, like, he's stubborn, and yeah. Anyway, he doesn't like to take care of himself, and that's one thing, like, with these, if you don't take care of it, like, instantly, it can get, like, really serious, and you could end up like my dad in the hospital, intubating, and not being able to breathe, and you're gonna have to have, like, a tube all the way through your throat, and that's not no fun time. Okay. Statical treatment. Treatment is heavily dictated by severity and whether the infection is community acquired, hospital acquired, or ventilator acquired. Like, there's different types to acquire pneumonia. Like, bacterial pneumonia, typically treated with antibiotics. You don't really need to stay in the hospital. They will just give you antibiotics. Sometimes you might need an IV antibiotic or additional treatment like corticosteroid and oxygen therapy, but it's not bad. Okay, like, and then we have the viral pneumonia. And this one generally does not respond to antibiotics, so treatment involves symptoms and supportive care like rest, hydration, fever control. Antivirals may be used for specific viruses like influenza, SARS, COVID-19. And the prognosis, most patients on effective treatment begin to see improvements in a couple days. Though recovery time depends heavily on illness and severity, pre-existing conditions. So, like, it also, like, the way you get better depends on how your overall health is. Like, my dad, he was, like, in the hospital for like 2 months, like 1 month intubated and sedated because he was going crazy because of the tube he had on his mouth, and he's still recovering from it. Okay. So yeah, physicians usually evaluate the severity and prognosis using standard clinical tools. Fever that comes with pneumonia usually goes away within a week. Symptoms like lingering cough and fatigue can last up to 4 weeks to 3 months, like my dad's. And severe cases require longer healing time and carry high mortality risk, like he was in that. And especially others can be in the ICU, so that was my dad. And well, I'm running out of time here, and that is all for this video. I hope you liked it, and I try my best to do these videos. I wait for your feedback. Bye.